downtown Little Rock. This is Capitol View.
Good Sunday morning to you. Welcome into Capitol View. I'm Jay Bir. Well, this week I sat down with Dr. Nate Smith to talk about how the state has responded to the COVID pandemic, also about how he handles the stresses of decision making, how this virus affects children, plenty more. Here's just part of my conversation with Dr. Nate. All right, Dr. Nate, first off, thanks for doing this for us. We certainly do appreciate it. I guess with today, I mean, how are you? How are you doing? How you been through this whole thing?
Well, I'm doing well. The governor mentioned virus fatigue. I guess all of us are a little tired, ready to get over this pandemic, but this is a serious issue. I mean, lives are being lost every day, and this is really why we went into public health, those of us who are in public health, is to be here to protect and improve the health and well-being of all Arkansans. So I don't get tired of that.
And I guess, too, what have the days been like for you, especially once we got really into the pandemic? And, you know, you're kind of a household name now, which I think if you'd asked anybody before March started, who's the Secretary of Health for Arkansas, nobody would have had any idea, but now you're kind of that guy here in the state.
Well, that's the nature of public health. Most of what we do is invisible. As long as there's not an outbreak, people don't know about us, but that's what we do all the time, is we protect and improve the health and well-being of all Arkansans. With this pandemic, of course, our role has been much more visible, and I really appreciate the fact that the public has appreciated what we do and what my team does, and the unsung heroes, now all of a sudden we can see what they're doing. So I guess if I had more time out and about, I'd enjoy the notoriety more, but I'll just take everyone's word that people are watching.
I guess what's the day-to-day like for you?
Well, my day starts with checking sort of the emails that have come in overnight, and I usually schedule some of the meetings that I need to do well before. Once we get up into mid-morning, though, you know, we're looking at the data, discussing with the governor what are the things that we need to address and highlight, and that sort of rolls on in until the afternoon press briefing. After that, then it's a chance to sort of process, look at some of these things, have some additional meetings, and if there's time, address some of the other things that other health issues that are addressing Arkansans. But really our focus is on COVID-19, making sure that we're responding appropriately and looking at the data, taking action.
Now, just as part of your job, you kind of just eat and breathe this stuff, but is there ever a chance that you get to just sort of check out from it at all?
Well, first of all, keeping up with the governor is not easy. He never lets down. You know, he's like an Energizer bunny. So certainly, you know, we've got to learn how to sort of refresh on the fly. You know, even weekends, you know, checking in on lab results, things of that sort. But there's a certain pattern to it. As a physician, I'm used to that. My wife's an obstetrician gynecologist, so she's never fully off. But you just sort of learn to deal with that.
Now, what's it been like, just being basically in the governor's hip pocket for, what are we looking at, 6 months now?
It's been an excellent partnership. The governor has made my job about as easy as it could be, and so no complaints there at all. That's really what it's taken to address this. And I've talked to my counterparts in other states, and you know, they're working just as hard, so I don't feel like I'm singled out in any way. But I wouldn't trade jobs with anyone in this country.
You know, Dr. Fauci has kind of said some things like maybe we've kind of gone too open too fast. Is that safe to say, or has Arkansas maybe approached this the right way?
Well, I mean, there's two ways to take that question. One is, how have we as a nation dealt with this, or how have we as a state? We as a state, I think, have done about as well as we could with the resources that we have available to us, you know, with some of the constraints that we've had in terms of supply chain. We've tried to take advantage from as many lessons learned from elsewhere, but this is a situation where everyone is experiencing at the same time, and no one's ever done it before. Typically, you'd have at least someone who had done it before. You could learn from them. We're all having to some extent, make educated guesses and and to do it together. And I think we've done it here in Arkansas about as well as we could. I would like if more Arkansans perceived not only that this is a serious problem, but this is a serious problem that they can really do something about, and that the efforts that they make will protect not only themselves, but their loved ones and their communities. And I think sometimes that message has been distorted from various sources.
When did you first get wind that COVID-19 was a thing?
You know, I had heard because I'm an infectious disease specialist and I'm naturally attracted to the latest infectious disease outbreak. I had read some preliminary reports, but I got a call from Dr. John Dreisner at the CDC. He's the director for the Center for Preparedness and Response, a friend of mine, previous state health officer in Tennessee. He called me up. He said, "Nate, I don't know if this is going to end up being anything, but there's this virus in Wuhan, China. It looks like it's spread mostly from animals to humans. We're not really seeing evidence for human-to-human spread, but I just want to let you know about it, gives you a heads up." Well, of course, later, this has become, the largest pandemic of our lifetimes.
When it finally got to Arkansas, kind of what was your thought process? What was sort of the mentality on trying to, because Arkansas was one of the last states to actually report cases, and now here we are.
It was, and we were looking very hard. We had limited laboratory testing capability at that time, but we were using it anytime we had someone who looked like they might be a case. Of course, we were particularly looking for those with history of international travel, so it's a little bit ironic that our first case was someone who had come from Louisiana.
I guess looking back, was there anything that you might do different than what we have done?
Well, there's all sorts of things that I would do different. To live through any life experience and say you have no regrets, nothing that you'd do differently, that basically is saying you've learned absolutely nothing. No, we've learned a lot. And I would think that we would collectively have done things a lot different. If we knew where things were going to end up. Certainly having earlier, larger testing capacity would have been a benefit. Certainly if it could have been contained within Wuhan, China, before it spread. These are all things that it certainly would have been worth a huge international investment to attack the problem then and there. But that's, again, who knew at that point? We're still learning, and there are things that that I might have done differently last week or the week before if I knew exactly where things were heading.
You've said in the briefings before that this virus affects children a little differently. What have we seen so far, and how does it affect them, and do we even know why it affects them differently?
Well, there's a lot of unanswered questions, and hopefully you'll get Dr. Jose Romero in this seat at some point, because he'll give you better answers, being a pediatric infectious disease specialist. But fortunately, and that is a blessed thing about this situation, if there's anything, is that children seem to be of less impacted than adults. And that's certainly not true with a lot of infectious diseases. A lot of infectious diseases, they adversely affect children disproportionately. In this case, children are less likely to develop severe disease, but it still does happen. And it does seem that they're not, they don't seem to be at least more likely to spread the disease than adults, and that's also a blessing. But there are some real challenges. This multi-system inflammatory syndrome that can occur as an immune response to the virus, that can be very, very serious, and we see that more in children than we do in adults.
So I guess with all that in mind, the biggest thing we're getting is parents. School's coming up. Is school going to be a safe environment? I mean, you figure a lot of districts are going to take the proper precautions as best they can, but is that an environment where we're just looking at a petri dish, or with that knowing that it just affects children differently, that maybe they'll actually end up being okay?
That's a very good question, and I would have to say that's a question that no one fully knows the answer to. School is important. There's a reason why we do it, and we wouldn't want to give that up unless we had exhausted every opportunity to make that happen. We know that, that there are some tremendous adverse effects by not having school, and we know that our children have in some ways suffered by having to basically end in-school instruction early this last semester. So there's a compelling reason to want to give it a try. Whether we'll be successful or not is going to depend on a lot of things, including where we are, at least here in Arkansas, with the number of cases and how active we have transmission at that point.
I guess, what does Dr. Nate Smith, what do you stress about the most when it comes to all this stuff?
My biggest concern is that people will get tired of doing the things that they need to do to protect themselves, their loved ones, and their communities. And, you know, as in a lot of life, you know, we really have to have the endurance to persevere. This virus may just wear many of us down. And although we know how to protect ourselves, we just give up and give in, and then that will cause unnecessary disease and death. So helping each other to learn how to change and adapt so that these things that we need to do to protect ourselves are things that we just incorporate into our normal daily lives. I know there's a lot of resistance to that. Change is hard, but if we can do that, we can protect one another. We can help get past this thing sooner. If we give up the effort, then we'll be dealing with this for a long, long time.
When will this be over?
That's not the $1 million or $1 billion, trillion dollar question, is when will this be over? I was kind of hoping it'd be over by, by the middle of this month, but it doesn't look like it's going to work out that way. Dr. Romero will have plenty of work to do. It's hard to know. I think that we will either find a way to get rid of this virus, or we'll find a way to adapt to it, one way or the other. But no one really knows how long it's going to be at this point.
And you can find that full interview up on our website, krk.com. Well, our very own Jessie Tenor interviewed President Trump this week. We'll talk to her about what he had to say about the stimulus checks and fighting COVID-19. You're watching Capitol View on Sunday morning.
I was in foot pain for 20 years. I bought all these products, and not a single one worked. When I drove past the Good Feet store, I thought, I'm going to stop in. What can it hurt? They wanted to make sure that they gave me the right arch support for my feet, not somebody else's feet. And you just knew, like, your feet just, when they got on the right ones, they were like, oh, yeah. I'm Teresa, and that's my Good Feet story.
See for yourself with a free personalized arch support fitting at the Good Feet store.
Sold it, sold it, sold it. Real estate and equipment auction, Tuesday, July 28th, 11 a.m. in Conway. 6.6 acres with a 2,200 square foot home and a 30 by 60 steel building. Also selling a John Deere tractor. Download the Wilson Auctioneers app and bid today. Sold it, sold it, sold it.
We're building the biggest news operation in the country. 5,500 journalists across the U.S. to deliver you news, not talk. Facts, not opinions. News Nation, coming September 1st to WGN America. Your news, your nation.
Disabled? Let's talk about Social Security. Every time you earned a paycheck, a little part of it went to pay the government for your Social Security disability insurance. When you paid in, you did your part. Now, if you can't work because you're disabled, the government needs to do its part. At Rainwater Holds in Sexton, we help people get the Social Security disability benefits they paid for and deserve. Anywhere in the state, dial 8.
Little Rock Family Dental Care is open and ready for patients. And we're going above and beyond what has been recommended. Masks, gloves, face shields, all of it, because we want you to feel safe. We take it very seriously. We're checking temps of everyone that comes in. Our newly redesigned lobby helps with more distance seating. You can even wait in your car if you want. All dental needs under one roof with 4 locations to better serve you. Little Rock Family Dental Care, making you smile again safely.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And welcome back into Capitol View. Well, it's not often you get to sit down with the president and talk to him one-on-one, but that is exactly what our D.C. correspondent Jessie Tenor got to do. And And she's here now, as you see right there. She's going to talk to us a little bit about that conversation. And I guess first and foremost, Jess, how you been? How's the district been? If it's as chaotic as it is down here, surely it is more so up there.
Yeah, the chaos still continues even in quarantine, working kind of this way with our computers instead of meeting face-to-face. But yeah, it's still definitely very busy and a lot to cover every day.
Absolutely. All right, so let's get to it here. Obviously, one of the big things that's been talked about here is potentially another round of stimulus checks. What did President Trump have to say? And I know you did this a little earlier in the week last week. So what has Congress maybe done in terms of addressing that from that conversation?
Yeah, during our interview, that was the first question that I had for the president, just because that was what we've been really hearing from a lot of our viewers, because that affects mostly every single American, right? And so he reiterated his support for it, saying that he would definitely make sure that a second round happens. But right now, negotiations with Congress are still continuing over an amount. Last time, about $1,200, depending on who you were, went out to Americans, sometimes more, depending on your family structure. And that's what House Democrats eventually landed on. They were first trying for about $2,000, so a little bit extra than what went out the first round. They landed on that in the HEROES Act, but the Senate has yet to take that up. And so President Trump was saying that he would actually like to see a larger amount, but there's not as much of an appetite for that right now on Capitol Hill.
And two, one thing that he was really hardballing on is this next round, whatever the coronavirus relief package might look like, is he wants a tax cut. Where is he looking to cut that, but about how much?
So he's looking for a payroll tax cut. And so that would essentially mean that your paycheck is more, but then there's different cuts to government programs like Medicare and Social Security. And so that's another thing that's kind of a hard sell right now on Capitol Hill, and not just for Democrats, but also Republicans. But it was kind of surprising in a way, his answer, because just the day before, White House Press Secretary Kayleigh McEnany was asked about it too, and she couldn't answer if the president would veto something that came across his desk if it didn't include a payroll tax cut. So for him to say that he would, very strongly that he would veto it was definitely some news there. And so we'll see if that was him just trying to, flex some muscle going into these negotiations, continuing these negotiations. So we'll eventually see where that ends up, but he definitely is still pushing very strongly for that.
Obviously, here in Arkansas last week, we saw some of the school issues that are starting to come out. School's going to be open. It's just a matter of what's it going to look like and all that kind of stuff here. President Trump also saying that school's got to open up. It's part of the economy. What kind of did he go into when it came to schools open, kind of with the economy aspect as well?
Yeah, so one of the things that he really touched on, of course, with, one of his priorities being the economy, is that one of the main things that has to happen is for kids to go back to school, because then a lot of parents, they can feel more comfortable going back to work and they can kind of get back to a regular routine. But then when I asked him specifically what his administration had in place or what specific actions his administration planned on taking, he didn't really have an answer to that. He said that the fall is still pretty far away, but when you ask teachers, administrators, parents, they don't really see it that far away, some in just several weeks. And so we saw that kind of play out later on in the week as well with his administration, with the White House Coronavirus Task Force, even Education Secretary Betsy DeVos, not really throwing out a federal plan and really deferring it to those states and really local communities exactly what's going on with the virus at the time that they're hoping to go back to school. And so while there is a lot of pressure to reopen schools, exactly how to do that is still really falling on the local communities, even though we have, federal entities like the CDC releasing guidelines. They're even saying these are not requirements, these are just suggestions. And so there's still not really a federal directive of sorts from the president telling schools exactly what they should do.
Oh, we could keep going on and on. We could do a whole show with me and Jesse, that's for sure here. One of these days, we might try to bang that out here. Jesse Tenor from up there in D.C., our correspondent. Girl, we always appreciate the time. You're welcome back in anytime.
Appreciate you.
All right. Well, Attorney General Bill Barr was in Arkansas this past week. When we come back, find out what he thinks about the law enforcement temperature here in Arkansas. You're watching Capitol View on Sunday morning.
in and out of tight spots without being in the car with Remote Smart Parking Assist in the all-new Sonata.
Drive home in a new 2020 Hyundai Sonata, starting at just $24,575. Complimentary maintenance included. Visit buyhyundai.com today.
If you or someone you love has been diagnosed with cancer and you routinely took Zantac for more than 6 months, you may be entitled to compensation. In April 2020, the FDA announced a mandatory recall of the popular heartburn medication Zantac, ordering the removal of Zantac and all its generic versions from store shelves because the drug contains probable cancer-causing ingredients. If you have cancer and you took Zantac, contact the Duncan Firm now at 877-638-6226 or duncanfirm.com.
There are now more options than ever to enjoy tzatziki's. Our Mediterranean menu is full of healthy and original favorites that are available for dine-in, delivery, takeout, curbside, and drive-through at select locations. We've implemented safety procedures to protect both our guests and our crews. Order online at tzatziki's.com or download our app today. Thank you for your continued support.
Real estate auction by Fowler Auctioneers. Attention cattlemen, land and timber buyers. 183 acres of land selling at public auction in Cattle Gap, Arkansas, presented by Fowler Auctioneers. Live auction will be Thursday, July 23rd at 10 a.m. Over 100 acres of prime pasture land and 80 acres of pine, mixed hardwood, and white oak timber. Live auction will be July 23rd at 10 a.m. or you can pre-bid your price now at FowlerAuctioneers.com. Auctioneer Nick Fowler, license number 162. Fowler Auctioneers Incorporated, sold in 30 days.
Tune in every Thursday morning for the Today Show Minute. Greg Curtis from the Good Earth Garden Center will share timely tips to keep your lawn and garden looking beautiful all year long. That's the Today Show Minute every Thursday morning on KARK4.
While the world may seem like it's upside down right now, there's never been a better time to develop new habits for a healthier world. Like walking more and driving less to cut down on harmful ground-level ozone. Learn more at ozoneactiondays.org.
Pull in and out of tight spots without being in the car with Remote Smart Parking Assist in the all-new Sonata.
Drive home in a new 2020 Hyundai Sonata, starting at just $24,575. Complimentary maintenance included. Visit buyhyundai.com today.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And welcome back to Capitol View. U.S. Attorney General William Barr in Arkansas last Thursday, along with an Arkansas delegation joining him. The group heard from local law enforcement agencies on the climate of law enforcement here in Arkansas. U.S. Attorney General Bill Barr visited with Arkansas representatives on law enforcement issues in Arkansas, and officials here say they had plenty to brag about.
What a good job that we do generally in the state on that. Training, the law enforcement academies, the certification, the removal of bad cops, and that their record travels with them in that record database.
A handful of protesters showed up outside the embassy suites Thursday afternoon. Natalie James with the protest says they wanted to get the attention of the top law enforcement official in the U.S.
We are asking that the police are defunded, and by defunded we mean reallocation as to 10% to 20% of their budget to be given to local communities, be given back to education and things that are needed in the city.
Defunding the police was a topic that did come up at the discussion, and it is one both Senator Cotton and Representative Hill are staunchly opposed to.
Defunding the police is a insane, counterproductive idea.
That's why defund the police is a meaningless slogan. That in fact, to have a better, more community-based policing system, you need more training, more engagement.
Senator Cotton said that many times training is the first thing cut when belts have to tighten up, and he proposes providing more resources for law enforcement.
So if anything, if we want to give our police the tools to maintain public safety and maintain the confidence of our people, we should be increasing law enforcement budgets.
Everyone did say there's room for reform, but they want to be in lockstep with police agencies while doing so.
Reform is not something that you do to police, it's something you do with police.
And Attorney General Barr says he looks forward to what the governor's law enforcement task force comes with, and he hopes to work with Arkansas in any way that he can with what that task force does come up with. Well, we're back to wrap it up after this. You're watching Capitol View on Sunday morning.